The COVID-19 outbreak has evolved into a historic pandemic with unprecedented disruption to global economies. Though people are eager to get back to their normal lives, we cannot wish the virus away. The option for countries all over the world to the present COVID-19 pandemic is through vaccines. As COVID-19 vaccines roll out across the globe, the Nigerian government is poised to receive its first set of doses by the end of January 2021. Yet, many Nigerians are skeptical and may not voluntarily come forward to get administered.
I need to note that I will not be taking that vaccine as a matter of my fundamental human right. I don't desire it. I have not seen it to have been proven to be of very high health value, so I will not be taking it.
I'm not going to take it because I don't know what they are bringing to give us here in Nigeria, so I will not take the COVID-19 vaccine.
No, I no go take them.
Why?
Yeah, because I don't know whether they are bringing the medicine to Nigeria. I don't know whether they have tested it to other people in the other country, whether it has worked.
What should be done to allay the fears of Nigerians who want to avoid taking the vaccines due to all manner of phobia? What should the government and its relevant agencies do to convince this set of Nigerians that submitting themselves to be administered is the best option? How do we deal with the growing anxiety amongst the people that the COVID-19 vaccine is both safe and essential? Hello and welcome to Break It Down, where we make matters of policies, societal issues, governance and development easily understood by all. With me today is Dr. Aminu Magashi Garba. Dr. Garba is the founder and coordinator, Africa Health Budget Network. On this show, we start from the basics. There is no other time than now that budget and health have been so important.
Yes.
What exactly do you do at the Africa Health Budget Network?
So thank you very much. The Africa Health Budget Network is committed to healthcare financing reforms, not only in Nigeria, but the entire Africa. We try to look at the Nigerian funding for health over the last 10 years, the African funding, and is it adequate? Is it equitably distributed? Is it transparently procured or provided? And is it also accountable to the Nigerian government and also the populace? So basically we do a budget advocacy to ensure that funding is available at the right time, in the right place, and also is adequate to cater for the entire Nigerians. So
from what you have done so far, what are your findings?
If you look at the trend of the health budget in Nigeria over the last 10 years, we are talking about a budget that is consistently around 5% and is always below 6% of the total national budget. Now this tells you that the budget over the last 10 years has been grossly inadequate to cater for the needs of Nigerians. Now this is the overall budget. When you go into the breakdown of the budget, we are looking at a budget that is providing for vaccines, for immunization, for family planning, for cancer, for life-saving drugs in the facility, for antenatal care, for infrastructure development. All these indices and budget category has shown that consistently over the last 10 years, we do not have enough budget to celebrate the Nigeria health sector.
But with the COVID-19 came some emergency measures.
Yes.
Would you say the government did well?
We're happy we are part of the international community. I think that's the blessing for now. The international community is catering for everybody, and we are expecting some contribution of a vaccine from the global coalition called the COVAX, which is being managed by WHO and the Gavi for Vaccine Alliance. But we are informed by the Minister of Finance, last week during a webinar, that Nigeria has not yet allocated budget for vaccine in 2021. But she mentioned that opportunity for supplementary budget to cater for the vaccine could be done. But right now, we have a lot of work to ensure that Nigeria has budgeted for the COVID-19 vaccine.
But we have the minister saying that Nigeria is expecting about 100,000 doses of the vaccine. And the government is going to spend so and such billions on COVID-19 vaccines. Yeah, it's conflicting from what you're saying.
So there's no conflict. Let me explain. What the minister was saying, and all the presidential task force on COVID-19, the National Primary Healthcare Development Agency, the Minister of Health and Finance, is the 100,000 doses of COVID-19 vaccine. We're not paying for that. This is part of the global, contribution to Africa and to Nigeria to support us to start getting energized and action. And this 100,000 doses of a vaccine is going to be catered for frontline health workers who are the most vulnerable, during this era. And it means that we are talking about 50,000 population, because when you have 100,000 vaccine doses, and each person will need to have 2 doses, that means with this 100,000 doses will cater for 50,000. So we are not there yet to put our money to procure vaccine. The 100 billion you mentioned is aspiration. That in 2021, the Minister of Finance will package a supplementary budget to submit to National Assembly, for approval. Then we have money to procure vaccine. But right now, in the 2021 budget, there's no money for vaccine procurement.
And would you agree that the government is proactive enough during this period? I think they are. What is your opinion?
So we need to do more.
Okay.
Getting a contribution from the global package of mechanism COVAX for vaccine. It's a good thing. We are part of the global community. We must benefit from that.
We're active, we're receptive, we are listening, we are learning.
Exactly.
I think our government is doing well.
So the government is doing well, but we need to also do more to put our resources. When you put your money at the table, no matter how small it is, you raise your level of capacity and also acceptance and credibility. So once you put your money at the table, naturally the global community can even give you more, because you are also contributing, funding to it. But I agree with you that the government is serious, the government is proactive, a lot of awareness creation. The presidential task force meets almost, twice a week, but we can do more.
We can always do more. So today, actually, we're talking anxiety over the COVID-19 vaccination. A lot of people believe that it is harmful.
Yes.
But then let's take it from the beginning. How is it administered? The COVID-19 vaccine.
So this is, this are a good time that you mentioned that we need to do more.
Yes.
And the administration of the COVID-19, the vaccine.
Yes, please let's try and break it down to the level of the average Nigerian right now.
I'm sure many people are watching the television, even at home, everywhere. The vaccine is given intramuscular, that is through the muzzle, and it's normally given on the upper arm of the body. So there's what you call a deltoid muzzle, which is at the upper arm, very soft and adequate.
Like you take the
exactly. So that's where intramuscular, that's where the COVID vaccine is provided.
Okay.
Yes.
When you take the first vaccine, when is the next vaccine given?
So
because we hear that it takes there should be some period of time between administering the first and the second.
Exactly. Now, so from all the studies and all what we have been seeing happening, monitoring the global community, so 3 to 4 weeks. That is the range that if anybody has the first dose, then 3 to 4 weeks the person should go back to the health workers to get the second dose of the COVID-19 vaccine.
Okay. Yes. And this is where the controversy comes. A lot of people have been asking questions, and a lot of things have been circulating on the social media to the effect that this vaccine at the end of the day may not even have any lasting protection against COVID-19. Would you say the vaccine actually can stop anybody? That's if somebody has had 2 doses of this vaccine, can that stop the person from getting COVID-19 again?
Yeah. So, I want to appeal to the public to relax and calm down. This pandemic, is something that came up without any warning. So it means that the scientists, the government, the policymakers, we in the civil society will continue to study and follow the pattern of the COVID-19. And you are aware that, vaccines generally, many vaccines do not provide a 100% live protection or immunity, but they provide some level of immunity. And of course, we should not forget the non-pharmaceutical, preventive measures. So the vaccine should not take away our effort to use face mask, social distancing, washing hand, and all the protective measures that have been learning over the time. But coming back to the, the efficacy of the vaccine, if somebody takes the first dose, the study has shown that about 52% of the population that takes the first dose, they will be protected, against the COVID-19 vaccine. And by the time the second dose is taken, about 95% population will be protected against the COVID-19 virus. It means there are some 5%, even after taking the second dose after 3 to 4 weeks, that may likely come back with the virus. So, but this is good. If you have 95% efficacy of any vaccine or drug, that is something worthy of celebration. But we should not lower the guard in ensuring that the non-pharmaceutical measures are also being adhered to.
A lot of people ask after taking the vaccine, after going through, because there's a lot of fear, there's a lot of uncertainty.
Yes.
And after going through all of this, why must I still wear a face mask? Why must I still wash my hands?
Yes. Yeah.
Why must I still social distance? Is it not an exercise in futility?
Yeah. Because the virus is a novel. That is, something that is new.
Yeah.
We are learning, and we need to use the vaccine over a time to monitor the trend and see that this could give us a 100% lifetime immunity. Remember, tuberculosis has vaccine. Remember the BCG we took when we are kids, and still some people come with tuberculosis when they grow older. It doesn't mean that the BCG is not effective, but it means that at some point we may be exposed to some of these infectious diseases. We are learning as we go along in this, surveillance, protection, understanding the COVID-19 virus. We need to learn as we are engaging the public.
Okay, who should take this vaccine? Who exactly should take this vaccine? Like as smokers, for example, if I am a smoker, am I immune? Should I take it? Am I at risk? Should I take it? If I have hypertension, should I take it? If I have maybe terminal disease like cancer, God forbid, should I take it? Stuff like that. Who should take this vaccine?
Yeah, so because everybody is at risk, the COVID-19 vaccine does not segregate and does not isolate anyone, from the infection. Children come with the COVID-19 virus, the young people, the adult population, the older age. Everybody should be entitled for the 2 doses of the vaccine. But because we don't have enough right now, we have the first 100,000 doses, so the focus is on the frontline health workers who are attending to us in our society. Then when we have the next batch, we'll keep expanding, those who travel every day, and those who are taking care of the patient at home, those who go to market on regular basis, the policy makers in the environment, those in the restaurant. So we'll keep expanding. And even those with the infection you mentioned, those with the cancer, with the diabetes, hypertension, the smokers, everybody should take the COVID-19 vaccine. But that is the reason why it should be taken, in a hospital or by a health worker, so that before a vaccine is given, there will be a small history taken to understand that the comorbidity there is, with that particular,
comorbidity.
that is the hypertension. Supposing you have a cancer, you can say it's comorbidity because you have a cancer or hypertension or diabetes. So that problem will also be monitored to avoid any complication of the vaccine. But everybody can take the vaccine.
If you ask me, I would take the COVID-19 vaccine any day.
Yes, that's true.
And I hope one day I'm selected. Somebody sees me now and says, okay, come and take the COVID-19 vaccine.
Yes.
I mean, it's the benefits are a lot more than the so-called risk, if there are any. We'll take a break now. When we come back, we'll still be talking the COVID-19 vaccines. I'm sure you're very interested in this topic because everybody all over the world, every single person wants to know how this COVID-19, this pandemic can be eradicated, how we can get back to our normal life.
Yes.
We'll be back. Stay tuned.
If it is free, I will take it.
Yes.
Why?
I don't want to die now.
But for vaccine, if I am approached to be vaccinated against COVID, well, I think I will make myself available.
You're welcome to Break It Down. And I am still with Dr. MAGASHI GARBA of the Africa Health Budget Network, and we are still discussing anxiety over COVID-19 vaccinations. So how can, there's still a lot of anxiety as you have, enlightened us. A lot of anxiety. A lot of Nigerians will tell you that they will not take it.
Yes.
A lot of religious organizations, well, this is not the first time, over the time have said, don't take vaccines. What can the government do to help people understand the benefits to them and in the general of this COVID-19? Because we've never had a pandemic in modern time that has so crippled our nation and our economy. What can the government do?
So thank you. Very good question. Whenever there is something new, there is always apprehension. It's part of the human nature. Anything, and a pandemic that is all over the world, 24 hours, news all over the world, in television, in radio, in social media, that is enough to even create the fear that people are experiencing in Nigeria. The government can do a lot, but the government needs all our support, to engage the public. So some of the area that the government can do to allay fears of the public is that when the vaccine is available in Nigeria, I want to urge the government to make it a very transparent process. Invite the media to witness the arrival of the COVID-19 vaccine, invite the civil society, the religious leaders, and everybody to come and witness that occasion. And even those the 50,000 doses of the vaccine, it shouldn't go to only health workers, but we could say okay, maybe 5,000 or 10,000 of that could also go to other vulnerable people in the country. The media are also on the front line, the religious leaders who are always preaching in the mosques and churches, the people that are teaching in the classroom. These are all vulnerable people, not only health workers. So we could say 40,000 could go to health workers and 10,000 should go to other vulnerable groups.
When you have a country that is still grappling with its health care system, does not have enough budget for health, is grappling with the pandemic and trying to curtail the pandemic and trying to provide a health service for people who already have the COVID-19. Where would that extra money come from? Are you talking about maybe the private corporations now, like they did before, to come in to help the government to source these vaccines?
So the private sector is one of them. We have billionaires in the country who can contribute funding to a pool of resources, a trust fund, to support the COVID-19 vaccine. Also remember that the Minister of Finance recently mentioned that the ministry is going to work with the National Assembly to establish what they call the Crisis Intervention Funds for COVID-19. Crisis Intervention Fund. Now this fund is all part of mobilizing resources to address the COVID-19 vaccine. And also, when you go to National Assembly, our friends there and our sisters and brothers, they are getting so much resources, allowances for different, category. At this emergency time, they can sacrifice some of this money to push it to the COVID-19 vaccine. We look at the presidency budget for feeding, for travelers, for newspapers, all the governments in Nigeria, 36 of them. If they can sacrifice little money, mop it into a pool, trust me, we can get
that
money
makes a
to
lot of
procure
sense.
the vaccine. It requires a genuine commitment and interest, transparency and
sacrifice.
And sacrifice that let us get it right for the first time to curtail and combat this COVID-19 virus,
especially with this second wave, which is like sparing nobody right
all over
now.
the place. We have, right as of yesterday, we have over 110,000 cases of COVID-19. We have over 1,400 deaths due to the COVID-19. We are reporting over 1,000 cases every day the last 7 days. This is an alarming message, for our political actors to make sacrifice for Nigerians, for Nigeria, within this 2021. We can do it. I promise you, we can do it.
I pray we can. Finally, the government has said that it plans to vaccinate 40% of the population by end this year. Is that not too ambitious?
So that is 80 million population in number. So we are talking about in the first quarter, maybe end of January or February, we are getting 100,000 doses. So it means to reach 80 million population, unless we are putting our money, is going to be very ambitious. But it can be done if we look at the healthcare financial reform and also mop up money somewhere and put our money at the table to procure the vaccine. But it's of course ambitious, but it can be done.
Okay, is your network, is your NGO involved in this distribution of the vaccine?
So we're involved in
because
advocacy.
maybe I'll come and meet you to
we're
take my
involved
shots.
in the advocacy. So that's our business. And engaging the media, like what we are doing now, advocating to political actors, engaging National Assembly. That's what we do. We try to influence them, convince them on the need to do what is right, and also put resources at the table, and not just money. There has to be transparency and accountability. There has to be, prudent spending of any resources for the COVID-19. So this is what we do within our network.
So there's no shortcut for me. So thank you very much. Thanks so much, sir, for being on this show.
Thank you very much.
It's been a very enlightening session.
Thank you.
And thanks for watching the show this week. We've been with Dr. Aminu Magashi Garba, founder, coordinator, Africa Health Budget Network. And today we discussed anxieties over the COVID-19 vaccine. We'll be back same time next week. This is Break It Down.